I went to bed about 11:30. I'd felt a little bit of discomfort, but more of a heartburn type of feeling. Uh, I went to sleep. I woke up about 3:15, 3:30. I had a very strong feeling of tightness in my chest muscles. It wasn't a normal situation, and I knew there was a problem. I told my wife to get up, that I was going to call 911. I told them I was having difficulty breathing, that I had pain in my chest muscles. They knocked on the door, they rolled a gurney in, they gave me an aspirin. They immediately opened my shirt and started attaching the electrodes for the EKG. And I heard the driver say, well, which hospital does he go to? And the technician said, this is one for Manatee Memorial. When we got there, they moved me right into a room, and the team started working on me. And then they said, let's move him into the stent lab. I did wake up in what I believe was the cardiac intensive care ward. I was hooked up to monitors. The first person that I saw was a Dr. Iyengar. It was still dark in the room. He came up very close to me and he said, you know, you've had a massive heart attack, but I want you to know that I think you're going to make it, and I think there'll be minimal damage. I think we got it just in time.
Mr. Coker was in his early 70s, and he's at this situation had what appeared to be a mild case of indigestion and chest pain development. Now, we tell every patient at home that the main thing is, if you have these types of symptoms, don't discount them. Really think about if they're not going away after a few minutes, especially after taking antacids or even a baby aspirin, get on that phone and call 911. It's very important that you do not sit back and just try to sleep off the symptoms, because it could be signifying something much, much worse. And in his situation, it was. The smart thing is they did call 911, and they did have EMS arrive, who made the diagnosis that the patient was definitely suffering something much worse, which was a STEMI. Now, a STEMI is considered an ST elevation myocardial infarction. What that means is an ST is a segment on your EKG. An EKG is something we do quite routinely for patients, and it's electrical monitoring of the heart. So if we see a segment of the EKG or multiple segments that are elevated and the patient's having significant chest pain or shortness of breath, it gives us an indication that their heart is really suffering and really needs help quickly. Well, Manatee Memorial Hospital is a chest pain accredited center, which means that patients who are suffering from chest pain, whether it be unstable angina versus a STEMI, can all be treated at this center. And the relationship that Manatee Hospital has with the community, with the EMTs, the paramedics, with the dispatching units, we have a great relationship with our ancillary staff. The EMS will evaluate the patient, call the emergency room, and let them know exactly what the patient is going through. If the EKG is performed right there, that information will be transmitted to the emergency room physician, who then will make the call of calling the cardiologist on call and letting us know this is actually a real heart attack. The next step is admitting the patient to the intensive care unit, the ICU, for observation. The main concern is that we keep the patient doing well throughout the procedure, and that's where the nursing staff, the technicians that are involved, the on-call staff that we have are phenomenal. They make a great team effort here, because again, there's not one person that's doing this procedure. It's a team effort every single time. Manatee Memorial Hospital has cutting-edge technology for cardiovascular care. I would tell anyone in the community, if they have issues when it relates to the heart or the vascular system, to have no doubt that we have the ability, the technology, and the team support to take care of them, whether it becomes a heart issue or a vascular issue.
I'm very impressed with their professionalism, with their level of training, with their efficiency, and their extreme competence. I felt like I was being dealt with by the very best.